REACT 2.0, which stands for Researching Eye Tracking to Assess Community Trust, is the follow-up study to my first REACT, which was my independent research project. If you haven't watched that video, I highly recommend doing that before you watch this one. For a little introduction into what this follow-up study was about, pretty much our main research question was how can different framing methods influence an individual's trust in online public health messaging? Now, this question is really important in finding ways to create effective public health messaging, especially with the prevalence of misinformation. Now, this study had two main hypotheses. The first being that gain frame prevention messages and loss frame detection messages are both linked to higher trust. The second one being that higher trust correlates with shorter fixation durations, fewer fixations in saccades, and aligns with self-reported trust. That pretty much just means that a person who trusts whatever they're reading is not going to engage with it as much because they have that higher trust. Now, to go over what gain frame means versus loss framed, gain framed is a message that highlights the benefits of something, like the benefits of putting on sunscreen, while loss framed messages highlight the risks of not doing it. So you could get skin cancer if you don't put on sunscreen. So just the way that we're wording our messages. Now, the reason that we use eye tracking is because our eyes are the first point of contact with visual information, and our eyes capture our immediate unconscious reactions before our actual cognitive processing occurs. Now, in this study, we use two main eye metrics, that's fixations and saccades. Fixations are when your eyes stop and focus, and we believe that lower fixations and shorter durations mean that there is less confusion and there's more trust. And saccades are pretty much the quick eye movements between focus points. That's when your eye goes back and forth. And so fewer saccades for us means less confusion, more trust. Now we're just going to go over the methodology of the study. And so the first step was for our participants to fill out a pre-questionnaire survey where we gathered their demographics. So some of the questions we asked were their age, level of education, how often they engage with health articles or news articles in general, political alignment, how trusting they think they are as a person. So just so we could get kind of a baseline of who they are. And then the second step was for them to go through 8 stimuli, which were these health articles from the CDC or the NIH and things like that. And we would track their eye movements with the Tobii eye tracker. Among these 8 stimuli, 4 were gain framed and 4 were loss framed. So we try to see what the differences are in their eye movements when looking at those 2 differently framed messages. After that, we had them do a kind of a verbal post survey for each of the stimuli. And we asked them on a scale of 1 to 5 how trusting they felt it. And we asked various questions to kind of gauge their level of trust. And then with all that information and data, we put it into a data pipeline so we could then analyze. So that analysis really comes from our 3 main data sources, which were our pre-questionnaire results, our post-survey, and then also those eye metrics that we got from the Tobii lab. So with those 3, we cleaned the data, kind of got the information that we truly wanted, and then we put it all into a master spreadsheet so we could then analyze it. So with that master spreadsheet, we then performed statistical tests on it so we could get that analysis. So the first statistical test we used was Chromebox Alpha. Now, Chromebox Alpha is used to check the consistency of questions from the post survey to make sure they're all measuring essentially the same thing and the data aligns. Then we use a correlation matrix, which helps us visualize the correlation between eye metrics, the post-survey results, and the stimulus framing topic, and showing the correlation in kind of a color scheme. And it's really only showing linear correlation. So then after that, we had to go in with t-tests to really see if there is statistical significance between 2 groups. For us, we used gain framed versus loss framed as our main 2 groups to determine whether they differed significantly. And then with all of that, we then created some nice visualizations that really represent that data. So for our results, here is our correlation matrix that we got from performing that statistical test. As you can see, it's a lot of different colors. But when we really go in and see that data, we can kind of take that through box plots where we can see which type of trust, whether that's cognitive or affective or the overall trust, had the most difference between gain framed and loss framed. And this is also just another way to represent how we saw fixations based on composite trust score. These graphs were incredibly helpful in creating visualizations so then we could go in and have meaningful takeaways. So our main takeaway from this study was that gain-framed public health messaging fosters a greater sense of trust rather than those loss-framed messages. This suggests that emphasizing the benefits of doing something may be more effective for getting people to take action. And additionally, we also found that eye tracking metrics did not align at all with the participants' self-reported trust, implying that eye metrics alone don't really reflect how an individual evaluates a message's credibility. But because our eye metrics were derived from text-based stimuli, factors such as reading speed or familiarity with the vocabulary used may have influenced the measures, creating just a level of bias in the data. But overall, the results that we got suggested that people rely more on their cognitive trust, which is that reasoning, rather than the emotional component of trust, potentially overlooking the affective or emotional responses when rating their trust in online health information. All in all, this study is certainly not finished and needs to really be tested with a far larger number of participants because we only really had 23 for this study. But once the study can be replicated on a larger scale, we can make grander assumptions on how to measure trust, which is right now a truly complicated metric. So with that information, a lot can be done with public health institutions, so we can produce health messages that are a lot more effective. And effective messaging is really important for helping people make informed decisions to protect their well-being. When messages are framed in ways that resonate with that audience, whether that's emphasizing those potential gains in that gain-framed messaging format, or just simplifying the complex information, individuals are more likely to engage, trust that source, and then act on the guidance provided. So in an environment where people are right now constantly exposed to competing information, whether that's information like misinformation or just multiple ideas at once, we need to have strong, well-designed health messaging so we can empower individuals to stay healthy.